Dr. Goodyear here. A little bit take on something that we're going to do here. I was actually down here in Orlando speaking at the A4M conference on multiomics, peptides, and cancer. And so we're in Epcot. So I figured what we could do is highlight some countries and their contribution to the integrative movement. And this morning we are first in France. Now the approach here is going to be just a little bit different, and it may be a little bit surprising. I want to talk just as short about wine. See, when you look at wine, here I'm particularly talking about red wine. This could be young, this could be aged. There's a lot of confusion out there. What we want to do is focus on the science. Really interesting, when you look at wine, particularly red wine, it is the compilation of the micro-constituents that have anti-inflammatory, that have antioxidative, but more have the anti-thrombotic effect. But platelets are intimate in how cancer invades, grows, and spreads. Very intimate there. So the micro-constituents within red wine actually help to counter the process of cancer through those three steps: antioxidant, but more probably anti-inflammatory, and second, anti-thrombotic. But if you drink in low to low moderation red wine without all the chemicals, the additives, etc., and you do so in a controlled manner, research actually suggests it's beneficial. Good, clean, organic, biodynamic red wine actually can be a way to live as you heal from cancer. Well, we are here again at our next stop. And of course, I am in Walt Disney World, but in Epcot, taking a little R&R after, again, speaking at the A4M conference. I wanted to talk about the natural, holistic, and integrative, contributions maybe from some of these countries. And one of them here is Mexico, and that contribution is IPT. Donato Garcia is a practicing physician in Mexico. His grandfather came up with the idea shortly after insulin was discovered in 1921 and then commercially came to market in 1923 about using insulin as a membrane modifier to help improve the passage of molecules of treatments across the cell membrane into the cell machinery of the cell. And lo and behold, he developed a process to use that initially with neurosyphilis and then carried that on into the treatment of cancer. So IPT, insulin potentiated low-dose chemotherapy, taking a very low-dose form of chemotherapy at about 5 to 10% of the maximum tolerated dose, which, by the way, does kill cancer cells, but it destroys the immune system, and that causes the cancer to spread. That is metastasis stage 4. What's interesting about IPT as a cancer treatment, compared in contrast to maximum tolerated dose chemotherapy, it's not going to war on the body. It's actually strengthening the body as it hits the cancer. You don't destroy the immune system as full dose chemo does. You actually support it. It's called an immunomodulatory therapy. So here, insulin plus low dose chemotherapy, combining it together. I want to thank the Donato Garcia family right here in Mexico City. Well, not really. We're in Epcot, but representing what they brought to the natural, holistic, and integrative arena from Mexico. Look forward to our next stop. Check in soon. We're here at China. Now, why would we stop here in China to talk about natural, holistic, and integrative therapies and their contribution to this movement of healing? Well, artesunate is a derivative that comes from artemisinin, that comes from sweet wormwood. It's called Artemisia annua. This comes from sweet wormwood. Sweet wormwood is an herb that over 70% of it comes from China. The team from China, here, Dr. Yu Tu and her team, they actually discovered how to use artemisinin in the treatment of malaria. But what's interesting about this therapy, artemisinin, artesunate, it has tremendous broad anti-cancer properties. Phase 1, Phase 2, Phase 3 studies from a conventional standpoint, even double-blinded randomized placebo-controlled trials, the gold calf, if you will, of conventional medicine. And this natural therapy can actually be used to treat broad cancer types. It can actually be used to stack therapies. Stacking is a process by which therapies are added together to stack effects and stack impact in the body. One example is artesunate with vitamin C, but also this therapy has broad, specific signaling pathways of how artesunate can actually fight cancer. One particular is it's immunomodulatory, stimulates the immune system. Again, I mentioned the stacking with vitamin C, but the third of the effects of artesunate in cancer is a process called ferroptosis. Apoptosis is a process by which the body will normally trigger abnormal cells to die. In this case, cancer would be abnormal. But in ferroptosis, things like artesunate or artemisinin are actually being used to target the high iron and high ferritin content within the cancer. Looking at ferroptosis, you're actually seeing the specifics of how artesunate and artemisinin actually targets iron within the cancer cells and uses that to very specifically kill cancer cells. So we are here highlighting how China has contributed to natural, holistic, and integrative medicine. Check you out in the next country. And we are in Germany, as you may hear in the background. So why would we stop in Germany to talk about their contribution through history to natural, holistic, and integrative cancer treatments? Well, I want to specifically talk about one in particular, mistletoe. Here, mistletoe is a parasitic plant. It's a plant that grows on the plant, so it's a parasite of another plant, but it is itself a plant. The great thing about mistletoe is there's broad anti-cancer evidence in the literature. Now, a lot of this is out of Europe, and of course in Germany, there's a broad integrated movement where mistletoe is actually used in conventional oncology. So when you look at mistletoe, it can be used as a standalone therapy to stimulate the immune system. Research shows natural killer cell number and activity, very helpful in the fight against cancer, number one. Number two, it can actually be used to improve quality of life measures, standalone. These would be the milder forms like Viscum abeatus. They don't necessarily attack cancer or stimulate the immune system, but you can be more aggressive and directly target cancer cells with types such as Viscum fraxini, where you can actually target and destroy the cancer cells, but also to stimulate the immune system. So the point here is we can use mistletoe to just simply improve quality of life. Research shows we can use mistletoe to be used in adjunctive therapy with maximum tolerated dose conventional chemotherapy, but it also can be used to reduce its side effects. So that's kind of a win-win situation. But here, with those forms of mistletoe that have high what's called viscotoxins, we can actually directly target the cancer cell. So mistletoe is a standalone therapy. But as is always the case in what I teach at Brio Medical, what we provide for our patients, is the stacking of therapy. Because cancer didn't occur because of one event. It occurred because of a stacking of sequence of events. So we must stack and sequence events, to stack and sequence of impact and effect to target cancer and heal the body. So this is Dr. Goodyear signing off from Germany, not with a kiss, but with a mistletoe therapy to help you in the treatment of cancer that comes from Germany. Check with you soon at our next stop. Here we are in the beautiful Italy in Epcot. What we want to do is touch on nutrition. Particularly, let's touch on a Mediterranean type of diet. When you look at nutrition, everybody thinks that nutrition is a one-size-fits-all approach. And of course, that comes from a conventional mindset, which is trying to fit everybody into a cookie-cutter approach. That is an archaic approach to the past of medicine. The future of medicine is actually a precision-based approach, an individualized-based approach. And understand that word precision literally means the freedom from inessential elements. And when you look at nutrition, it is just that. It is foundational to the treatment of cancer. Now, it's foundational to the prevention of cancer, but it's also foundational to the treatment of cancer. But specific, that is the Mediterranean diet, the broad-based platform that it is, it really sets a broad strategy of what you can do to actually prevent disease, not just cancer, diabetes, cardiovascular disease, but also to actively treat cancer. But if we use a plant-based diet that's full of healthy fats, the right source of proteins, organic, biodynamic, not adulterated, studies show that you can actually use that to prevent disease, cure cancer, also be used to treat or augment cancer treatments, whether that be integrative or conventional. When you look at nutrition, it is literally the means to communicate with your DNA. But diet, nutrition, and we're using Mediterranean diet here in Italy to give you the implications of not only what it can do to augment conventional cancer therapy, but what it can do to change the very expression of your genetics into RNA, into protein, and to change the environment so that cancer no longer exists and never will return. So, amore from Italy. We'll catch you on our next stop. Next up on our journey around the countries of the globe, we're in the United States. So looking at the contribution of natural, holistic, integrative cancer therapies, or therapies in general, from the United States, unfortunately, I'm sorry to say that it's been more obstacles than contributions. Those that have contributed to this advancement of healing therapies have been more obstructed than helped. There's been more blocking, more obstruction, more limitations of contributors from the U.S. via natural, holistic, and integrative cancer therapies via U.S. physicians. So because such limited contribution has occurred here, we're going to be moving on. Sorry, hopefully the future will bring brighter and better things for the U.S. to this arena, because there's some good doctors out there. Check you on the next side and the next country. As we make our way around the globe to the countries here at Epcot, a little synthetic tour of the world, if you will, from a natural, holistic, and integrative perspective of contribution from these countries in history. We are in Japan. So what I want to talk about here is that in Japan is talk actually about hyperthermia. And why would we use hyperthermia? Well, there was a surgeon back in the late 19th century by the name of William Coley. He was a surgeon that was treating sarcomas. These are muscle tumors. And what he noticed is that his surgical treatments of these tumors were failing left and right. So what he started doing was injecting killed bacteria to induce an inflammatory response. Increasing heat is a byproduct of that process. That is a fever. So hyperthermia is really just mimicking in a controlled manner what Dr. William Coley did in the treatment of his sarcomas. And by the way, did it help his patients? Absolutely. It cured many of his patients, and many of his patients it cured for decades. So if you can control and stimulate the immune system, and that's what hyperthermia actually does, you can actually not only directly kill the cancer cells, but also stimulate the immune system to do the thing. And here's the other great strategy, again, that word, stacking. Stacking hyperthermia with other things. Stacking hyperthermia with vitamin C, stacking hyperthermia with peptides, stacking hyperthermia with curcumin. Repetitive theme, and you can find these therapies at Brio Medical in the beautiful Scottsdale, Arizona. I'm Dr. Goodyear. I'll see you in our next stop. So here we are, our next stop. We are in the country of Morocco. Specifically, I want to focus on a spice that's actually used in the treatment of cancer. But here in Morocco, they're actually using it as a major contributor of spice in their food. But curcumin, beyond just its spice as a spicy agent to flavor food, curcumin has incredible anti-cancer properties. And I would actually make this statement. There's probably not a natural therapy that has more broad anti-cancer approaches, more treatments, more effects, actually founded in the science. There's probably not a therapy that has more evidence than curcumin. And yes, it's a natural therapy. It comes from turmeric, that's a root. But here, curcumin in Morocco is being used as a spice, but at Brio, we're actually using curcumin in the broad but targeted treatment of cancer. And let's give you one example. If a patient has a cancer type that is expressing what's called a P13K AKT mTOR mutation, this is a normal pro-growth pathway. Curcumin actually can come in and suppress that growth. So what we're looking at here is a spice used in treatment here in Morocco that can actually be used evidence-based wise in the treatment of cancer. How? It inhibits that pro-growth pathway, but it also inhibits nuclear factor kappa B, which is the primary transcription factor for inflammation. So that is curcumin. We're in Morocco, and we're going to be hitting our next and final spot, that is UK, where we're going to talk about vitamin C, the flagship of integrative therapies. Well, here we are on our last stop of this global tour around the countries of the globe here represented at Epcot. So here we are in the UK. We are in England. Now, I want to look at this more from the perspective of the UK, the United Kingdom, because the contribution here is coming from a physician out of actually Scotland. Scotland brought forth a physician by the name of Ewan Cameron. Now, Ewan Cameron is the lesser well-known partner of a duo that you've probably heard of, the other part, that is Linus Pauling. We're talking about the use of vitamin C in the treatment of cancer. There's probably not a treatment of cancer, whether conventional, natural, holistic, or integrative, that has more evidence than vitamin C. Yet it becomes the most controversial. Vitamin C, this partnership of Linus Pauling and Ewan Cameron, they were a partnership that actually first used vitamin C in the treatment of cancer patients and actually prolonged survival in these patients with stage 4 cancer. They did 2 studies. The important thing about vitamin C is that we must individualize this. You know, as I mentioned before, the world of multi-omics, which is the future of medicine that's present today, it is the personalized, precision-based aspect of what we do at Brio Medical. And vitamin C is just that. So let me give you some examples of that. If the cancer is expressing BRAF mutation, CRAS mutation, vitamin C specifically helps there. If the cancer cell is producing a lot of circulating tumor cells, platelet cancer cells, circulating tumor cells that buffer the cancer cell from circulating natural killer cells, immune cells that target the cancer, vitamin C will penetrate that and target the cancer cells. Vitamin C will stimulate natural killer cells, but more, vitamin C given IV therapeutically actually promotes a cytotoxic effect, but it does so via what's called a dualistic principle. That's something that I came up with. That is, it will target the cancer cell, will create a detoxification crisis and an energy crisis by depleting the cancer cell of reduced glutathione as well as NAD, but not in the healthy cells. Wonderful nature of what cancer therapies do that are natural. They target the cancer cell, but they don't hurt the rest of the body. That's how you use vitamin C via a pro-oxidative approach that can only be achieved via IV. And by the way, we know what level in the blood that should be. It's vitamin C. That's the contribution of UK to natural, holistic, and integrative cancer therapies. And that is our last stop here in our tour of the countries in Epcot. And we're signing off, and we'll talk to you soon.